Hi, I'm Dr. Broussard with the Wagon Train Veterinary Clinic, and in today's segment, we're going to discuss surgery in dogs. So we put together a list of commonly asked questions, and my assistant Cole and I are going to run through those questions to hopefully give you a better idea of what to expect if your dog is in need of surgery. Cole?
Dr. Broussard, what do I need to know before my dog has surgery?
I think probably the best way to answer that, depending on the procedure that your dog is scheduled to have, you need to know things like how do you need to prepare beforehand, i.e. fasting, food and water, maybe prepare a space when you get them home, that kind of thing. And you should also be inquiring about what is going to be required after surgery. So like I said, maybe a special space, a kennel, a cushioned bed, maybe an e-collar. Those kind of things would be questions that I would strongly suggest you inquire about before the day of surgery so you can be better prepared when they get home.
Will my dog need lab work done prior to having surgery?
Well, and that's going to be at the discretion of your veterinarian, but I would always tell you that it is suggested, and it is also, here at my practice, it's always recommended. It's not always mandatory. I just don't make it 100% mandatory, but I will tell you that I think it's always 100% wise to do. Why? Because it uncovers things that you just can't detect on a physical exam. It lets us have an idea what the animal's liver and kidneys and electrolytes and all those other internal parameters that we just can't pick up on a physical. It lets us know how they're doing, how they're functioning, so that hopefully that animal can better metabolize and get over these anesthetic agents.
Does my dog need to see a specialist for their surgery?
That's a good question. Again, depends on what surgery we're talking about. So the more routine elective surgeries, spays, neuters, growth removals, dentals, all those kind of things, no. I mean, your average veterinarian, like myself, we do those on a daily basis practically, and we do them all the time. So there's really no reason to consult a specialist with that. Where a specialist typically comes in is if you're dealing with, say your dog has a tumor in a very difficult spot, or a place that like a practitioner like myself just doesn't really work with on a regular basis, then yeah, I would feel more comfortable, and you should too as an owner, consulting a specialist for something like that. The other more common way is orthopedic surgeries. A lot of us as veterinarians don't receive specialty training in orthopedic repairs. Some people learn from on-the-job experience, but unless you continue and go to become a board-certified orthopedic surgeon, which I am not, there's a small handful of people that are. And so if you have complicated fractures, or you have to plate or do total hip replacements, or there's a lot of advanced procedures that go on that we're just never taught and learned and taught how to do. So that's, I think, the biggest reason why a surgical specialist would be consulted for things such as that.
What will my veterinarian be looking for in the pre-surgery lab work?
Well, I kind of touched upon it already. So the biggest thing I'm personally looking, well, there's a lot of things, but I mean, probably the two biggest would be liver and kidneys. And the reason why is because your liver especially is how the majority of those injectable anesthetics anyway are metabolized. So if the liver's not up to snuff, then I might just say, whoa, hold up, let's figure this out first. But I also look at things like red blood cell count. Is that dog anemic or not anemic? White blood cell count. Is there another infection that this dog's maybe already fighting that we didn't know about? And do I want to do surgery when a dog's already dealing with an infection? Maybe let's hold off on the surgery, get him on some antibiotics or whatever we can do to resolve this infection, and then we'll revisit whatever the surgery was for. Probably the other thing, which is arguably one of the bigger ones, is coagulation times, clotting times. If I'm about to put a scalpel blade in my hand and start cutting on a dog, I want to make sure that when I'm finished cutting and I try to put the puzzle back together, that I don't have blood vessels that are just continue to bleed on, because for obvious reasons that can be less than compatible with life. So yeah, that's a long answer, but for all of those reasons, those are things I'm looking for, and that's why I do think blood work beforehand is wise.
Who will be monitoring my dog while under anesthesia?
While the veterinarian is the one doing the surgery, and of course I'm obviously in the room and I can hear the monitors and see the monitors, the most of the monitoring is done by our veterinary assistants or technicians. I have a full trained staff of girls that do this with me every day and are very, very well trained and adept at what they're doing. So they are there, and if anything goes on, because again, keep in mind, once I'm in surgery, I'm sterile. I can't just stop what I'm doing and go touching the machine and doing all these other things. I can't. I have to keep my hands in that sterile field. So most of the girls, and I say girls, it's my staff happens to be all female. That's not always the case, obviously, but those guys are the ones that go through the training, and they know very well how to monitor blood pressure, EKGs, pulse rates, oxygen levels. All of those things are being monitored literally every second of the procedure, every procedure that we do. And if something's not right, they usually jump on it right away. We can adjust fluid rates, we can adjust depth of anesthesia, we can add pain medicine into the regimen. All of those things can be done in a moment's notice if that need arrives.
How long will my dog need to recover after having surgery?
Very dependent on what the surgery is. Routine procedures like a castration or maybe even a spay, perhaps just a few days and the dog can be back up on their feet, maybe not at full activity, it might be closer to a week or 10 days before they're really ready to go. But then you have the opposite end of the spectrum with orthopedic procedures. If you have a fracture repair or a total hip replacement, maybe a TPLO that's done on a cruciate repair, something like that, those guys takes weeks and weeks and weeks to get them back where they need to be, sometimes even months in those things. So to answer how long will it take to recover, it just depends on what it is, how did the procedure go, and honestly, how still did you keep your dog? Because a lot of those anesthetic orthopedic procedures do require a good bit of physical therapy and exercise restriction afterwards. So all of that factors into how long it will take your dog to fully and properly recover.
How can I best help my dog recover at home after surgery?
I'm sorry, how can you best help your dog what?
Recover at home after
Recover from surgery. I think confinement's probably the most important thing, really. Again, I can't go into every specific surgery because this would take hours, literally. But I will tell you that if there was a procedure going on that required general anesthetic and perhaps even a cutting of something, then that cutting area is gonna require healing. And the best way to do that is to rest. Good diet, but rest. The more active an animal is, the more they're stretching, pulling, those kind of things at a surgical site, not good. That's gonna delay healing. It's gonna cause more pain, all that kind of thing. So again, go back to the beginning. One of the questions you need to ask is prepare that ahead of time. But I think that rest is probably the single word answer I could give you to recover most any surgery I can think of. Okay, all right, that does it for this segment, guys. I appreciate you tuning in. If you have any other questions, you can always reach out to us, call us, come by, reach us on Facebook, whatever's easiest for you. We're here. Again, thanks for tuning in, and we'll talk to you soon. Bye-bye.